Uh, Thank you very much and welcome everyone. This is the coalition conversation from the Moving Forward Nursing Home Quality Coalition for this month. My name is Alice Bonner, and I'm very glad as chair of Moving Forward to be co-hosting this today with a number of folks from Moving Forward. Claire Rogowski, who's put a bunch of comments in the chat already with instructions for everyone. Jennifer Baker, who's our policy director. You're going to hear from her later. I see Katie Smith Sloan is also on, president and CEO of Leading Age, and very much involved in the Moving Forward Coalition projects. So today our topic is about Medicaid and the importance of why Medicaid matters for nursing home quality. And we have a whole panel of people who are going to speak to that today and hopefully share ideas, some of which will be new to you, some of which may reinforce thinking that you've already got about why Medicaid is so important. I don't think I need to tell anyone on this call, most likely, that there is a lot of activity right now, happened overnight on, in Congress, in the Senate, looking at the reconciliation bill and related things. So all of this is important. But the first thing is to start with why we need to have this conversation right now. And in particular, there was a recent Kaiser Family Foundation study that found that only 36% of Americans know that Medicaid is the primary payer for nursing home care for the majority of it. And that's despite the fact that 1.2 million people live in nursing homes, 1.5 million work in nursing homes, and countless families and care partners depend on nursing homes for the people who are living there. So, as our nation is aging even more rapidly, a robust long-term care system is really critical. And right now, where our federal systems are considering these deep cuts to Medicaid, we need to navigate reduced budgets and figure out how we're going to provide really good long-term care and support so that every American knows that Medicaid is vital to improving access and quality of nursing home care, to support workforce stability, and to enhance quality of life for residents. So you're going to hear a lot more about that today. But Americans need to know that cuts to Medicaid may reduce access to care and at the same time undermine quality and workforce stability, as we just said. And we need to make sure that people who depend on nursing homes for their care and support are not out of sight. They cannot be invisible. They cannot be people that no one ever talks to or visits. About half of people who live in nursing homes, never have a visitor. So these are all important experiences. So by the end of today's conversation, we hope that you'll leave with a deeper understanding of why Medicaid is essential to nursing home quality and what is at stake right now with the proposed cuts, and how each of us, whether we're advocates, professionals, community members, residents, how we can use our voice to raise awareness to ensure evidence and experience are informing the policy discussions that are happening right now. So, just a brief reminder, I know some of you are on a lot of these calls and some of you may never have been on one of our conversations, but the Moving Forward Coalition came about after the 2022 NASEM report called The National Imperative to Improve Nursing Home Quality. And in addition, we were strengthened after the COVID-19 pandemic when so many people in nursing homes died, and there was just a lot of focus on people living in nursing homes, their quality of life and their safety. So we are a nonpartisan, cross-sector and very diverse coalition, and we have residents, care partners, direct care workers, providers, and advocates. So again, part of our strength, we believe, is in that diversity and our work with different vulnerable populations. In partnering with our steering committee on these issues, these Medicaid cuts, we've launched a campaign, and you may have seen some of this. You may have gotten our newsletter Momentum that Claire and Jennifer send out. But we also have sent a letter to the Senate Finance Committee about why Medicaid matters for nursing home quality. That's available. We've got some of these things on our website, so you can see that. We also have been encouraging a video campaign. So we've reached out to many of you and others, to say, what if we had nursing home residents and other, direct care staff talking about these Medicaid cuts, people from communities talking about the Medicaid cuts, and specifically the impact on the lives of people who live and work in nursing homes. And then we're doing this coalition conversation today. So really excited, and our panelists will introduce themselves in a moment. So in setting the stage for the conversation, we have brought together this panel with three, people with three powerful voices, and each person has a very unique perspective on why Medicaid matters. So we have a national policy expert who's, has a grounded understanding of available evidence and data and trends related to Medicaid and nursing home quality. We have a national leader in consumer advocacy who works directly with residents and families to improve quality. And we have a nursing home resident leader and someone who's president of the resident council where she lives, to talk about the impact of these policies every day. So with that, please, again, chat in any questions, and we'll be reviewing the chat all during the call. But now it's time to do some brief introductions, and each of the panelists is going to give you just a few minutes, about 3 minutes or so, of a reflection of what they're thinking about why Medicaid matters to nursing home quality from their perspective and their experience. So first, I'm going to turn to Priya, and then to Lori, and then to Jeanette. So Priya Chidambaram is a senior policy manager at Kaiser Family Foundation's program on Medicaid and the uninsured. And Lori Smetanka will speak next. She's the executive director of the National Consumer Voice for Quality Long-Term Care. And Jeanette Sullivan Martinez will speak next. She is a nursing home resident and resident council president in Connecticut. And Lori and Jeanette are both on our steering committee. So with that, Priya, we'll turn it over to you. And what would you like to say to the attendees here today about you and your work with KFF?
Sure. Thanks, Alice. Thanks, everyone, for being here. Thanks for having me. So as Alice mentioned, my name is Priya Chidambaram. I'm with KFF's program on Medicaid and the uninsured. So kind of broadly, what I do in my role, the first is analysis of proposed legislation and how it would impact people enrolled in the Medicaid program. So right now, as you can imagine, it's kind of what probably a lot of you are doing right now. It's reconciliation tracking all day, every day. While I usually focus on issues pretty specifically related to seniors, people with disabilities, and nursing facilities, I've been doing a lot more work kind of on the broader cuts to the Medicaid program, things related to work requirements, the eligibility rules, because those cuts, while they may not seem directly related to cuts to long-term care, they are going to have an impact on these populations that we're talking about today, because cuts to Medicaid mean less federal money flowing into states, which means that states will have to make cuts, and it's likely that services for seniors and people with disabilities are going to be on the chopping block. While nursing facility care is mandatory to provide through the Medicaid program for people who are eligible for Medicaid, states can take measures to limit the number of Medicaid enrollees who are eligible. So just because they have to provide that kind of care to people who are eligible for Medicaid, one thing that states can do is tighten eligibility rules, or get rid of optional Medicaid eligibility pathways that a lot of people rely heavily on to get nursing home care. So there are a lot of implications to this bill, kind of just beyond some of the cuts, like some of the less clear cuts to the long-term care programs. So a little bit more about why Medicaid matters for nursing home quality. And these numbers may come up a couple times during our call, but Medicaid is the primary payer for long-term care in the U.S. It pays for just under half of all nursing home care in the U.S. And at the person level, Medicaid is the primary payer for about 60% of people living in nursing homes. And I think Alice mentioned this stat, but I mean, the stat always gets me. It's that 4 in 10 adults believe that Medicare is the primary source of coverage for low-income people who need long-term nursing home care, and that's just not true. Medicaid is is the payer for long-term nursing home stays. That kind of care is not offered by Medicare, and it's otherwise unaffordable for people who need that kind of care. The average cost of a private room in a nursing home was $116,000 in 2023. I mean, that's like a mind-blowing amount of money, especially when you consider the median income for a Medicare beneficiary was just about $36,000. So Medicaid covers the cost of care and services in nursing homes that other payers just are not providing. The two other quick points I'll make are Medicaid's reimbursement rates are closely tied to staffing, and we'll talk a little bit more about staffing maybe later, but Medicaid reimbursement rates and staffing and quality of care are so closely intertwined. And then finally, something that's not strictly related to Medicaid, but kind of broadly about how the bill would relate to or would affect the nursing home workforce and therefore would affect quality are the immigration provisions in the bill. The bill provides additional funding to ICE to expand detention and deportation of immigrants in the US, and immigrants make up about 21% of all direct care workers in nursing homes. And so it's just not possible to disentangle the immigration provisions in the bill from nursing home quality, just given how important immigrants are to the nursing home workforce. I'll turn it over to Lori or back to Alice. Yeah.
I was just going to add before we turn to Lori that I hope people are thinking about what are some of the things that we can do. I know we'll circle back to that toward the end, but what are some of the things that we can do? Because we don't want people to say, oh, things are so terrible. And so, we're just in this terrible time of uncertainty. Like, we know that, okay, but let's come together and say, here's what we can do one small step at a time. So anyway, but thank you. That was a great overview and kicking us off. Lori, what would you like to add or say in addition to what Priya shared? Oh, yeah, you're on mute. There you go.
Got it. I should know that by now, after how many years of being on video. But anyway, thanks so much, Alice and Claire and Jennifer, for inviting me to be part of this today. This is a really critical conversation because of the threats to Medicaid that we are experiencing. I mean, I would say ditto to everything that Priya said for sure. Medicaid is a critically important program for people that need long-term care and services, because as she said, it is the primary payer of long-term care and just a really important part of people accessing nursing home care. With proposed cuts to Medicaid, not only are we talking about less access to care, and we're talking about people who live in home and community-based options or receive care at home and community-based options, but also for people living in nursing homes. And so if there were the cuts that are being proposed to Medicaid, not only would people have less access to care, but it really would be pushing people towards nursing homes, when so many people want to be staying in their homes and to receive care and services where they already live with their families. But we have to really think about our long-term care system holistically and think about long-term care as a holistic setting, holistically in terms of where people are receiving services. And the cost of long-term care, as Priya was saying, is really prohibitive. So many people are unable to afford it with even lifetimes worth of savings because it is so costly. And Medicaid is what really helps people not only access and afford long-term care, but it also helps with healthy aging, which is a big push right now that we're talking about as well, in terms of people that do need care and services, to help them receive what it is that they need in order to maintain some of their health and maintain some of their dignity. So as we're talking about cuts, we're talking about less access, and we're talking about reduced quality, because if we don't have the access to Medicaid that we need in order to cover costs of services, we'll see reduced quality in nursing homes as providers would be forced to have to make cuts to staffing, so to services, to supplies, to access to the different resources that are really critical to ensure that people do receive those care and services. Cuts would really result in less quality care and reduced care and worse outcomes for the people that really need the services. And when we're talking about, some of our most vulnerable individuals, in this country, we really need to be looking at how we can beef up and support those individuals and the care providers that are providing care and services to them. So I think I'll turn it over to Jeanette at this point, or Alice, if there was anything else you want to talk about. I know we're going to talk about all of these things in different capacities in the rest of the conversation, and we can, add some more detail to them. But really critically, this is a critical time that people need to be engaged and raising their voices and talking about the importance of Medicare in terms of access and quality care.
Yeah, I think before we turn to Jeanette, I would just say there's a very active chat going on, and people are talking about what you just said, Lori, that it is time to act now. Grassroots matters. And someone chatted in, well, small steps may not be enough right now. And I would agree, small steps by themselves, not enough right now, but small steps can matter, and they can build and grow. And if we can get enough people, size matters in terms of the numbers of people who are coming together and saying the same thing and sending the same message. So again, organizations, coalitions like Moving Forward Coalition, organizations that all of you, many of you who are chatting in where you're from, you're making the point that all of us can come together and do these things. So let's keep this part of the conversation going, because it really is about not only small steps, but lots of marchers, Terry Kennedy said. Terry's out in Kansas, yes. So anyway, so with that, let's turn it over to Jeanette. Jeanette, what would you like to say about Medicaid and life in nursing homes?
I think the one thing that we need to really keep in mind, and you brought it up just a few minutes ago, Alice, is that we're people. We're not just numbers on somebody's report card or, memo that, oh, you've got to cut this person because they are a Medicaid person and they'll no longer qualify. And I think keeping in mind that this affects individuals' mental well-being, especially the physical well-being of having to have care. And that would affect us as far as time-wise, being able to participate in other things because you're waiting so long to be able to get dressed and up and out of bed. Keeping in mind that the people that are affected in the community, if services are cut, that they'll be then indoctrinated into a nursing facility, which then if they're also Medicaid cut, they're going to have less staff. The dignity and value of those persons' lives will change drastically. And I think our goal long-term should be that individuals residing in nursing facilities, living in their neighborhood, in their communities, are very viable individuals, and that we matter as people, and therefore Medicaid matters because it affects the quality and the dignity and the reality of the lives that we live.
Well, Jeanette, that was so well said as always. And I think, you've really honed in on something that other people are kind of getting at in the chat, which is this is a person-centered approach, and it has to be we have to keep our humanity at the center here, and that has to drive everything we do. We cannot forget, even if we're talking about systems and we're talking about government and we're talking about financing, yes, all of those things are important, but at the center of it all, it's the people who live in and work in nursing homes who really matter and are making a difference. I see that Alyssa Kennedy has her hand raised, and Claire, I don't know if we can unmute Alyssa for a moment. Or allow her to unmute herself. Alyssa, if you have a question or want to make a comment about anything that's been said, go ahead.
First off, I'm wondering, can I have a copy of the recording in the chat? Second, I don't know what's wrong with my thing, but my name's really Catherine Hine. And lastly, I wanted to ask, last Wednesday I spoke at the Capitol, and I wanted to ask if there was a way I could share a copy of my speech with the group.
You wanted to see if you could share your speech with this group,
Mm-hmm.
the speech you gave at the Capitol?
Yeah.
Oh, well, that Claire or Jennifer, if we're able to do that, maybe we can get in touch with Alyssa and get a copy of that, that would be great. And we can take a look at that. What was the topic? Oh, you went off.
Yeah.
Yeah.
Yeah, if it would be wonderful if you have a copy of that, just to plug it into the chat here and folks can look at it if they're interested, and just so appreciate your jumping in here. We will have time at the end for Q&A, and so we'll continue to open it up for discussion after we get through some prepared questions here.
Great. Thank you so much. And thank you for going to the Capitol and speaking up. That's, that's a great example of any of us can do that, right? And, whatever your perspective is, whatever your opinions are, that doesn't matter to us. What matters to us is just each person feeling the agency and taking on making your voice heard. That's what's so critical here. And it really does matter that people are hearing from you, because again, many of us on this call, not just Moving Forward Coalition participants, but many of us are in conversations with people in Congress, people in state legislatures, people, who are in communities and local governance, mayors, town councils, et cetera. And, some of those people know about nursing homes and who lives there and who works there, and others just don't. And so back to, when Priya started and she was talking about Medicaid and how people just don't have a basic understanding of the financing systems of long-term care in the United States. Again, these are all reasons why it's so important that every single one of us takes this back and says, what can I do? What can we do together? But Jeanette, before we go back to Priya, I'm just wondering, is there anything else that you might want to say, particularly about resident councils? Because we know you're the president of the resident council in the nursing home where you live. Is there anything you want to say about tools or resources or tying back the resident council work to the Medicaid issues we're talking about today?
Well, I will comment when the issues first started coming out with regards to getting rid of Medicaid, there was a lot of fear among our residents, not just in my building, but I heard it throughout our nation on several different calls that I was on. I received an email even this morning from a woman, I believe from the Midwest, and she was telling me about how she has a certain medication she needs to get at a certain time. But because of cuts, which they've already, I guess, started implementing where she lives, staffing's always been an issue anyway. She ended up not getting one of her medications for like 16 hours, and she was in a lot of pain. And she was commenting how there's not enough staffing because the nurse had to take care of 2 floors rather than just 1 floor because of cuts for staffing. That's just a small measure of how Medicaid cuts will affect people getting medication. Myself, I receive a certain drug that is a specialty medication that Medicaid does cover for me, which has kept my multiple sclerosis stable for the last 15 years. If Medicaid, this cut goes through, that drug might not be available to me because I would never be able to afford it. So that is a big concern that I even personally have. I've heard others in resident councils, more complaints with regards to if they do this, it's going to cut the food. Am I going to have a place to live? I hear that quite often. Is there going to be a place for me to live with all these cuts? I have no family, no one can take me. And those are the stories that like break your heart, because I know I have a very supportive family, and if something were to happen, they would rally to try to do something for me. But there are so many people out there that do not have that. And with the Medicaid cuts, that could greatly has impacted them mentally and emotionally. And those are big issues that have come up at resident councils.
Yeah, I think you're, talking about the fearfulness and the anxiety that is, increased so significantly right now with these conversations is important. And who's having conversations with people who are in nursing homes? It's great. Again, if you have a strong resident council, that's an opportunity. Patricia Adler also put in about family councils, and family councils are separate from resident councils. Not every nursing home has a family council. Every nursing home should have a resident council if even one resident wants to do it. I know we have Anna Fisher, Dr. Anna Fisher on this call, who's doing a lot of work with resident councils nationally as well as in Connecticut. So, well, thank you for that. And maybe we'll swing back to Priya. And, you know, if you want to say a little bit more, Priya, about, you know, based on KFF's work, you know, health policy research and policy evaluations and the polling that you do, you know, what do you think is the most important thing for people listening to know and to share with their communities about Medicaid's role in nursing home care, in addition to what you said before?
Sure. So, I mean, I think a lot of the data points I mentioned before are important. Medicaid is a really important payer for this kind of care. But I think to kind of look at it from a different perspective, I think we need to understand a little bit about why nursing home care itself is so critical and why why another type of care may not just be a replacement for nursing home care. You can get comprehensive medical care, 24/7 supervision, specialized services that are a lot harder to replicate at home, and for some people are not possible to replicate at home. And so nursing homes themselves are a structured environment that have social opportunities, and that's also really beneficial for people who have like memory care issues in particular. And so nursing homes themselves are not necessarily replaceable with other types of care. And I think that's something that we really need to, that people really need to understand. People don't always get the type of care that they can get in a nursing home at home. And I think the conversation that also can and should be had is that nursing home quality is not up to par in all or most facilities. But nursing homes do play an important role in the overall continuum of care. And so the replacement is not just everyone receive care at home. We really should be talking about how do we make sure that nursing homes, you know, they are important, they exist for a reason, and how do we make them like a great place to live and a great place to age.
Yeah, and again, that's, I think, why it's so valuable for any of us and all of us to, you know, go and meet with our legislators or speak with our legislators or leave a voicemail or whatever and talk about nursing homes and, you know, what we see that's so positive. Again, you know, the voices of people like Jeanette, and we have other nursing home residents on this call. I saw Marguerite was on. We've got other folks, and being able to amplify the voice of people who live in nursing homes and work and do policy work such as KFF, and really amplify so that people learn more about what they can be. And, you know, what does it mean to have really good quality of life in a nursing home? Here's all the elements. And here's an example of where it's happening and what it looks like. So Jennifer, at Anna's suggestion, just chatted in the guide to strengthening resident councils that was developed with the Moving Forward Coalition Steering Committee and our working committee that Anna and Marie Painter co-led. And it's free, it's downloadable, it's available on the website. So again, if you're interested in resident council work, please take a look at that. We made it available. I want to go back to Priya to one other thing, which is in one of your recent KFF briefs, you highlighted how the proposed federal Medicaid cuts could really undermine efforts to increase staffing levels. And you said something about that earlier. That's such an essential pillar of quality. Do you want to say a little bit more about how Medicaid and staffing is related, and anything else that you want the group to know?
Sure. So the most recent Senate language that I saw actually rolled back the prohibition of the Senate staffing rule and turned it into a moratorium until October 2034. I don't know that that's really going to do much, but that's kind of where we are. That's probably the most recent policy landscape that I'm aware of. But research finds very consistently that higher staffing levels in nursing homes are pretty consistently tied to better outcomes for people that live there, and therefore a better quality of care, better quality of life in nursing homes. So to talk a little bit about what the staffing requirements were prior to the rule, and for those of you who don't know, last April, the Biden administration finalized a rule that basically implemented the first federal minimum staffing levels in nursing homes. A court overturned it somewhat recently, and then the reconciliation bill has some language that would basically put a moratorium on implementing it or enforcing it at all. So that's the rule that I'm talking about when I'm talking about this staffing rule. So prior to that staffing rule, the only federal requirements for staffing were that irrespective of facility size, there had to be one RN on staff for 8 consecutive hours a day. and at least one RN or LPN for the remaining 16 hours. There were no requirements for nurse aides. And I'm sure most of you are aware, nurse aides play a very critical role in helping nursing home residents. And there were also no minimum staffing ratios that would account for facility size. So a facility that had 10 residents had the same requirements as a facility that had 80 residents. So we looked at the impacts of the rule, and we found that overall staffing levels in nursing homes are pretty dangerously low. About 1 in 5 facilities met the requirements in the rule. And the percentage of for-profit facilities that met the rule versus the percentage of nonprofit or government-owned facilities that met the rule, not for-profit facilities, a much lower share met the requirements that were in the rule that was passed last April. 12% versus close to half of nonprofit facilities were meeting the requirements. So there are some questions about profit status and whether profit status is a part of whether facilities are able to meet these staffing requirements or not. And there was one projection that was made, I think by UPenn, saying that the rule was projected to save about 13,000 lives a year because low staffing can lead to people dying. And so as far as how Medicaid is intertwined in all this, state Medicaid programs can support staffing efforts through higher payment rates, but those payment rates are going to be unsustainable if Medicaid spending is significantly cut, because again, states will have to make choices on where to cut funding, and it's possible that payment rates to nursing homes are going to be on the chopping block. And one thing to note here is that increased reimbursement rates to nursing homes don't always mean higher wages for staff. One of the big black boxes in the nursing home data is we don't really know how facilities are leveraging the funds that come their way and what profit margins are. So to target that issue, state Medicaid programs are making some efforts to target the nursing home workforce a little bit more directly and improving the quality of life for nursing home staff a little bit more directly. So we've seen states increase minimum wage kind of statewide in order to those increases would apply to the nursing home workforce. We've seen them strengthen direct care worker benefits. We've also seen them require that reimbursement increases to nursing homes would have to be passed through to wages, to worker wages themselves. We've seen that states are using the Medicaid program to promote and subsidize healthcare careers, increase payments to nursing homes that are shown to have higher levels of staffing, and also provide incentive payments when a nursing home shows that they've spent a certain amount of their revenue on workforce compensation. So states are using their Medicaid programs in a number of different ways, and it is impossible, I think, to disentangle the importance of Medicaid reimbursement rates to staffing and wages.
Well, that is a very comprehensive primer about the staffing rule and the relationship of staffing and Medicaid and how important that is. I think that kind of leads us back to Lori for one of the things she was going to talk about, which is, as you said, Priya, if there is not adequate staffing, that does lead to nursing home closures in many communities, and in areas that are very rural where there might only be one nursing home for miles and miles. It can be devastating. So Lori, do you want to say a little bit more about nursing home closures around the country? And, I know that there was a study from Brown about something like 600 nursing homes at risk of closure. So could you say more about how the Medicaid cuts might tie in with that?
Yeah, absolutely. But if I could just, before I say that, just to back onto what, Priya had said, when we talk about staffing levels in nursing homes, lower levels of staffing, not only generally results in lower quality care that residents receive, but it also reduces job quality for the workers who are there, and often leads to higher turnover, which then it's a really bad cyclical event then, when we're talking about lower staffing, higher turnover, lower job quality, lower quality care. So it's all very much intertwined, and will affect not only the residents, but the people that are working at the long-term care facilities as well. As you're talking about the threats to, with respect to closure, the study that you mentioned that was recently done by Brown identified nearly 600 nursing homes that would be at risk of closure if cuts went into effect. And they looked at 3 different factors that indicated a nursing home would be at high risk for closure. One is the reliance on Medicaid, and those facilities that had higher reliance on Medicaid, and they looked at 85% of the residents' care was covered by Medicaid, and in those facilities were really higher at risk than those that had maybe a more balanced payment mechanism between different payment sources like Medicare or private health insurance. But those that rely much more on Medicaid were at higher risk. Those that had lower occupancy rates at the same time were at higher risk, and also those that had poor quality ratings, specifically those with 1 or 2 stars. And when you look at those 3 factors, we're talking about 600 nursing homes across the country that are really at risk for closure. And that is really significant. That's a large number of facilities. That's a lot of beds. And that's a lot of people that would be potentially displaced. When we're talking about closures of nursing homes, that has a very serious effect on residents of nursing homes, because that often means that when they have to move, there aren't always available good choices for them in their communities near their families. So many residents, when a nursing home closes, have to look really outside of their communities. We even see some residents having to move to different states, maybe hours away from their loved ones, because there are not good options or good choices that are available to them. And that, certainly increases incidents of depression, anxiety, isolation for those residents, which all is wrapped up in what we call transfer trauma, leads to poorer outcomes for those individuals, declines in health, and really, puts the individuals at risk. So, closures to nursing homes are very significant in the sense that, excuse me, that, think about, being upended, or being forced to leave your home. That's what's happening here. It's not just, kind of that type of, that setting is closing. This is the resident's home. And this is where they're comfortable. They have friends, they have family, they have community there, and that is being completely upended. And as I mentioned, it's a really big impact on the communities in which the nursing homes are existing, because certainly it takes away needed jobs from all of the people that are working in those areas, and it really does result in a loss of community for the people who both have worked and lived in those areas. I mean, when we think about it, we really do need to be looking at, how do we protect residents and staff? How do we work to ensure that facilities are providing the best care possible, and that we're looking at other options other than closure? I mean, certainly protecting Medicaid is one of those things that we need to be doing, and advocating against these proposed cuts is really critical. As we've been saying multiple times during this call, now is the time that you need to be letting your member of Congress know that they should vote against these proposed cuts, that the ripple effect of these proposed cuts will be long and wide and very damaging for millions and millions of people. But we also need to be looking at how we support residents at the facility level. I mean, we should not, be having situations where facilities are at risk. And so how do we ensure that people can be supported, working and supporting, strong resident and family councils we talked about is certainly, a critical way, supporting the long-term care ombudsman program that advocates on behalf of individuals and facilities. And frankly, for those facilities that are struggling, ensuring accountability for poor care and inadequate staffing, which not only leads to and affects resident care, but also poor working conditions. So all of this, the finances, the quality, is definitely all tied together. And as we advocate for better care, we need to be advocating for adequate financing as well.
Even for food reimbursement. I was gonna say, even for food reimbursement, because I know for my facility, for per person, it's just a little over $5 a day for food reimbursement. That's not just per meal, that's the day. And think about it, on the average, if you go through a coffee shop, pick up a bagel and a coffee, you're spending that. And so what they deem to be suitable for a person living in a nursing facility is only that small amount of money, $5. I mean, that a little more than $5. I know there's a budget each facility has to hold on to, but they base a lot of their budget on what the reimbursement they would get through Medicaid. So not only does it affect a resident's overall well-being of possibly having to be moved and relocated, and or the possibility of not having a place to live, so they're dealing with that. Now it's not only going to affect those issues of having the comfort of being in your own safe home, getting the care that you're used to, it's now affecting what you're able to put into your body, because then the quality of food is dispersed even to a smaller level than it already is. So therefore, it affects every component of an individual living in a nursing home. Every component.
Absolutely. Supplies, access to resources, all of those things. Jeanette, you're absolutely right. Mhm.
And Jane Carmody, who's our senior program officer, because we are generously funded by the John A. Hartford Foundation. Jane just chatted in, ask your congressional senators and representatives, could they live on $5 a day for food? Even better might be to have them come to a nursing home and have them eat those meals for a few days and experience that. We've talked about food. Jeanette talked about medications. Lori and Priya talked about what matters and having an actual home and that environment. We didn't talk about mobility yet, but having access to a mobility program where people can actually be ambulating or moving their upper extremities or whatever as needed. So those are the 4 M's, what matters: medication, mentation, and mobility. So all of these things are affected, as Jeanette said, very much. So Jane, I don't know if you want to add anything. I know you just chatted in about a visit to a nursing home and making it personal. Part of this is like, so what can we all do now? So Jane, I don't know if you want to come off mute and add anything to that. Oh, you're on mute. Oh, Claire, can we unmute Jane?
Thanks so much for that, Alice. What a great and an important conversation having. And then to your point, Alice, what can we do and how can we? I've never said to as we reach out, of course, we have very supportive senators and Congress folks in here in New York, but I've never really told them about the food priced, Jeanette, and I think that would make it important. And I love the idea of making it personal. I was just a quick note, Alice, and I do have to leave a little early, but I was at a meeting and where was Megan Wolf was there, and she was presenting about age-friendly public health and some of the work that they're doing. And when we are talking about age-friendly, it was interesting because people were kind of talking and saying, now it's personal. Now it affects me. Now it affects my family. It affects my parents, my grandparents, my spouse, my kids. And so I think anything we can do, as you have just said, Jeanette and Lori and Priya, it's personal. I mean, this is a personal battle that each of us, not only for ourselves, of course, for everyone, but it is personal. And that's how we have to make it to our Congress folks, I guess. Thank you, Alice.
I think that's absolutely great. And I'm so glad that you chimed in. And Megan Wolf is on the call today, or has been on the call. Claire, I don't know if Megan's still on the call, if we can unmute her. And Megan, we would just invite you to say anything you'd like to add to the conversation in your role leading the age-friendly public health work around the country and the ecosystems.
Thanks, Alice and Jane and Jennifer. Really good to be. I've learned so much today, and public health doesn't really, I think, engage enough with the nursing home community and with long-term care. And I think that there are a lot of roles to play for age-friendly public health, but I think it's important for us right now in this moment to have a bigger view of what's important, right? And a bigger view of what age-friendly means. And it means engaging across all the sectors, including nursing homes. So I appreciate being part of this conversation. And the storytelling is absolutely the most important part when you're advocating, with policymakers or, anybody who has any authority in, financing or funding, whether it's federal, state, or local. It's the storytelling. Been on Capitol Hill many times, and when you can engage with someone and it hits home for them, that's when they begin to really listen and think, oh my gosh, yeah, we really need to do something about this. So kudos to all of you for what you're doing. Really appreciate the wonderful advocacy and the commitment to these issues.
Well, thank you, Megan, and back at you, because you guys, TIFA is Trust for America's Health is out there leading the charge on a lot of this. I just want to say, I hope people are reading the chat. There's just a lot of good conversation about, yes, politicians should be going to nursing homes and should be talking with the people who voted for them. And actually, they should be talking to everybody. So we'll just say that. But Dwight Faustino wrote in, and asked a question, which maybe we'll turn back to our three panelists and others to answer, which is, have we reached out to Congress to explore how they might assist with resources related to staffing, recruitment, and retention? Again, we don't want to fail to mention on this call, we have a lot of nursing home owners, operators, direct care staff on this call. There are many people working incredibly hard in nursing homes on staffing, on recruitment, on retention. And there's a lot of great examples of really wonderful quality out there. But for the places that still want to seize the opportunity to continue to improve whatever they're doing, what do you think, Lori, Priya, Jeanette, and anybody else who wants to unmute themselves to jump in? What else can we be doing? I think we've heard call Congress, but
yeah, I mean, I think there certainly are a number of programs that have been proposed both at the federal level and at state levels that are are being promoted to support staffing levels, to increase funding, to support the direct care staff training, recruitment. There's money that was included in the rule last year that the administration had put into effect. As Priya said, a number of states have been looking at their own budgets to see what they could be including and there's a lot of work being done through training programs. There's advocating for additional funds through like elder justice proposals that are being supported. But we really do need this groundswell of people to raise up their voices in support. And certainly telling your story is absolutely critical, but reaching out to your member of Congress, calling the congressional switchboard and asking, to be connected with your member, or writing a letter or an email to that individual that includes their stories on the Consumer Voices website at theconsumervoice.org. We actually have a letter that you could put, we have a letter that you could click on, that you could insert. It's information about Medicaid and why it's important for people that live in long-term care and receive services, but you could include your story in there and then have it sent directly to your member of Congress. And we also collect stories and use them in advocacy and share them with policymakers as well. But we have a Get Involved tab and an Advocacy tab on our website as well, where you can get information about talking to the press and writing an op-ed and using social media to raise your voices. But that's really what's needed at this moment, is for the policymakers to hear the groundswell that people oppose cutting Medicaid, and actually we need to be focusing in on how we can support long-term care providers, how we can support direct care staff, and how we can support the people that live and receive long-term care services.
I think that's great. So people have heard about that. And I just chatted in also, in addition to state level and federal level, think about your local city or town or your county. If, some states have very strong county systems, others don't, but still, the mayor in your city or your town, what does that individual know about the nursing home in your town? They may never have been there. Maybe they go there frequently. We don't know, but find out, pick up the phone, call them, go down to their office, whatever. Again, it's just whatever your perspective is, whatever your opinion is, it's getting your voice heard. I also want to, I know Claudia Balog chatted in about direct care workers and CNAs. You've heard other panelists speak about that. And Claudia is on our steering committee. And Claudia, if you want to come off of mute and add anything else about, making sure the voice of direct care workers is heard, or any other thoughts or suggestions that you might have as well.
Thanks, Alice. Hi, everyone. I'm Claudia Balog. I'm an assistant director of research with 1199 SEIU. We are the largest healthcare workers union in the country, and we represent thousands of workers in long-term care settings, including skilled nursing facilities. And the voices of workers have been really powerful, particularly in this moment right now. We have been holding lobby days. We have been recruiting CNAs across our geographic footprint to DC to tell the story. Like, what does it mean when I'm a worker, I'm on the night shift, and I'm charged with caring for residents, but 20 at a time? What does that mean for residents? What does it mean for your loved one when they're ringing the call bell and there's one person on staff or two people on staff? What does it mean for the timely dispensation of medication? What does it mean to live in dignity? And I think, workers have a really important voice in that conversation. And as somebody who's participated in moving forward for quite some time, I think it's really powerful when workers and resident advocates and members of industry who want to see quality in this industry kind of join together as a united voice on issues like staffing, and certainly on issues like these potentially devastating Medicaid cuts. And states are all over the map. I want to say, we have members in states from Massachusetts down to Florida. And every one of our states, New York looks very different than Maryland, and it looks very different than Florida, and it looks very different than New Jersey. Because so much of the decision making on the spending of those Medicaid dollars sort of hinges on state assembly advocacy and state legislative advocacy. And so, we're in this moment in time right now federally, but these state conversations are ongoing. And, so.
Right. No, very important. Thank you so much. I'm so glad you spoke up about that. And really important. Local, we got that going on in the chat. State, federal, even county can be in that conversation. So thank you so much. Before we turn it over to final comments from each of our panelists, I just wanted to see if one more person might want to chime in here. Katie Sloan, since you're on this call with us today, and you're leading us in this work as well, and doing global work in aging, is there anything that you'd like to add to the conversation here before we hear from our panelists with their final comments?
I just want to say thank you to the panelists, and thank you to Alice and Jennifer and Claire for hosting this conversation. It's really important. It's really timely. I think the Senate is voting as we speak, but it still has to go to the House. So the stakes are still really, really, really high. But I think what has been great about today is we've teased out not just the direct Medicaid cuts issue, but all of the ancillary issues that are impacted as a result of Medicaid cuts. And it's devastating. So just thanks to all of you for all the advocacy you do. We continue to beat the drum as well. And just thanks for the great work of this coalition. It's making a difference, and that's what's important.
All right. Well, thank you so much. So with that framing, one final thought from each of our wonderful panelists from today, and just many thanks to you guys. We know you're all super busy doing so much advocacy right now, but we appreciate your being on the call. What is the one thing above all else that you would love for people to take back about Medicaid cuts today from this call? Jeanette, maybe we'll start with you.
I knew you were going to do that. I think you only want one word. I was going to say.
No, it doesn't have to be one word. It can be one sentence.
Okay. No, it's not Alice. I think that's important for people to share their voice and their feelings. And it never runs old. Keep doing it and doing it, because the only way change happens is if you keep at it. So please fight for the rest of us that live in places like this so that we can stay in our homes.
Yeah, we need it now more than ever. Priya, how about you?
Yeah, coming from KFF, we can't really do a call to action or kind of like advocacy work. But I think, I mean, I always come back to the data, which is that Medicaid cuts to nursing homes would be a double whammy. It's not just the people who live in nursing homes that are covered, but the staff that work there as well. Nearly a third of them rely on Medicaid for their primary health insurance. So, I mean, it's important to nursing homes in basically every way you could imagine.
The data is key. So thank you for saying that. The evidence is where it's at. Lori, you get the last word, my friend.
Yeah, thanks so much. I mean, I think this has been an incredibly important conversation. Medicaid is so critical to ensure that people are able to receive care and services. Without it, and with cuts that are being proposed, many would not be able to access services. They will either be forced into or out of long-term care facilities. They will result in loss of care, loss of jobs, loss of services. And I will put out a call to action. It literally is, please call today. And call often. Over the next several days are going to be really, really critical. Please call. And you just have to say oppose cuts to Medicaid in the budget bill. But it's simple. Don't be afraid. Just do it. And your voice is really, really necessary.
Right.
Okay.
And we had, Lori chatted in how to get information from Consumer Voice. Terry Kennedy chatted in about how to reach out to Congress. So all of those things are important. And finally, many thanks to Jennifer Baker and Claire Rogowski, who put this whole thing together. And it was their idea that we really needed to do this now. So kudos to them. In addition, please take a look in the chat right now. We're putting in links, and you can get the Moving Forward Coalition newsletter called Momentum. You just get it once a month, so it will not overwhelm your inbox. And please do what our three panelists said. Make your voice heard now. Do it today. Pick up the phone, hang up from this call, pick up the phone, call your folks in Congress, your state reps, or your local contacts as well. And just remember, if we don't do it, they're not going to hear the voice of nursing home residents and all of your voices that are so important, every single one of you. It's important now, today, and even after things get signed into law, it still is important. So again, please share in your life, as Jennifer put in the chat, about why Medicaid matters to you and why it matters to all of us, and especially to quality in nursing homes. So with that, we ended 1 minute shy of 12 noon Eastern, but thank you all so much. We're going to keep doing this. We're going to keep this conversation going, and we're really grateful to all of our panelists and everybody else on the call. So please stay connected, be a participant with our coalition, sign up for the newsletter if you'd like, and we're going to keep following it along day to day. So we will continue to be in touch. Thank you, everybody. Thanks so much.
Thanks. Thank you.
Thanks, everyone.
Thank you,
Thank you.
everyone.